In this next segment, we went to East Jefferson General Hospital where we learned the latest about arthritis and total joint replacement technology. Take a look.
Arthritis is a destruction of the joint surface, and all our bones are covered with a shiny white cartilage surface, like that shiny white stuff on the end of a chicken bone. That allows them to glide against each other. And when that surface starts getting disrupted and it can get disrupted from different processes, the end point is that the cartilage surface degenerates, and then you have bone rubbing against bone, and that's what causes the pain associated with arthritis. There's probably no real way to prevent arthritis, but you can help with the pain of arthritis and help preserve your joints as long as possible by maintaining a healthy weight and by eating well and exercising. Heredity does play a role, but it's not a direct link. There are types of arthritis that do run in families, especially like rheumatoid arthritis. I think it's more common in women because the women have looser joints, and because of the hormones, so that we can have babies, and with the laxity of our joints, we do suffer a little bit more micro trauma to our joints, and then that micro trauma over years develops into the macro trauma of the degeneration of the cartilage. A joint replacement surgery is a very major surgery, but it is very helpful in relieving the pain associated with arthritis. And 95% of patients can get back to walking without any aids and have minimal or no pain after the surgery. What we do with a total joint replacement is we cut the ends of the bone where the arthritis is and take those pieces out and basically resurface the bone with a metal implant. And there's a piece of plastic that sits in between the metal and allows it to glide against the metal. The recovery time is in total about a year. Within 2 weeks, most patients are walking pretty well, but it takes about a full year to gain the most benefit from the joint and to also regain all your strength. Rehab is essential after a total joint replacement and usually is required for the first 6 weeks. Most patients have regained a lot of their strength after the first 6 weeks, but they'll continue to improve for that first year. The average age is probably about 60, but it is starting to get a bit younger as we have more folks that are active and don't want to live with the pain of arthritis that long and are seeing it affect their daily activities. And so they want to get back to being able to do their activities. A joint replacement is never exactly the same as what God gave us, but it does get pretty close, and it does allow most people to get back to a pretty active lifestyle of walking, even playing tennis, and more low-impact exercises. Some people will even be able to get back to higher impact exercises like running, but most of the time we recommend trying to stay away from very high impact exercises because it can decrease the lifespan of the joint. There are Also, treatments for arthritis short of a total joint replacement if someone's starting to have some pain but not really having enough pain to warrant a large surgery like a total joint replacement, such as injections. And there's two different types of injections. There's cortisone injections, which most people have heard of. Then those help by decreasing the inflammation in the joint and decreasing swelling. They also help with pain. And for people, it's just a matter of how long it lasts for them. In some patients, it will last several months, and we can always repeat those. In other patients, it doesn't last that long. There's a newer type of injection as well called Synvisc or Euflexa that is actually a component of the normal fluid that's found in the knee, and that works by improving the lubrication of the knee. It's a series of 3 injections that's given a week apart, but it does tend to help, especially earlier in the course of arthritis. But I've had some success with using it in patients, even with end-stage arthritis, who have wanted to delay surgery for a while. Those tend to last 6 months to up to a year.